From the Toronto Star, I'm Adrian Chung, and this matters. The nature of a pandemic, the textbook definition of one, is that a virus spreads globally. Can a pandemic truly end if billions of people around the world don't have access to vaccines? For the wealthiest nations, vaccine supply is no longer an issue. Canada, for example, has more than 20 million COVID doses stockpiled in freezers across the country. But vaccine supply, or the lack of it, is among the biggest problems that lower-income nations are facing. Governments of developing nations don't have the money to beat out wealthy countries for contract bids to pharmaceutical companies. And what you end up with is a world being split by have and have-not nations in a worldwide plague. Enter COVAX, the World Health Organization program designed to solve this problem. Rather than having nations hoard their vaccine supply, COVAX helps share those vaccines with countries in need. And right now, that's more than 130 nations. But as we're learning, the goal of delivering those vaccines is falling well short of what's needed. On This Matters, we're joined by Dr. Margaret Harris, an expert in infectious diseases outbreaks and a spokesperson for the WHO. She'll explain how this program is trying to solve perhaps the most complex geopolitical problem in human history, and why, until everyone is safe, no one is really safe. Dr. Harris, thank you for joining us to talk about this.
It's a pleasure to be with you. It's a very important subject.
You know, many rich nations like Canada and the US at this stage in the pandemic have a lot of vaccine supply. These are not nations that need to access the COVAX program. And because of that, I think there are many people who may not know what COVAX is or what the program is for. So let's start with the basics. Can you explain what exactly COVAX does?
Yeah, so COVAX is actually the vaccines pillar of something called the ACT Accelerator. And this is one of the most beautiful ideas humans have ever come up with. In fact, I think it encapsulates the best of humanity because it's about bringing our science, our intelligence, and our decency, our desire to work together to bring solutions in solidarity. And the idea is that this is everybody around the world. This is not about whether you're rich or poor, gets together, pools resources, finds the very best thing. So the ACT Accelerator was diagnostics, drugs, but also vaccines. And at that time when we started this, when this idea came together, it was back in April 2020. We were 2 months into the pandemic. We didn't know whether we had any answers, but we certainly had the scientists racing to find solutions. So the idea was to finance a lot of those solutions, also at the same time finance the manufacturing of those solutions, so that should any of the extraordinary work going on bear fruit, we could get it out to people right away. Second thing was to get it out equitably, because we've seen with past pandemics, past outbreaks, past crises, that those with most resources tend to grab whatever new thing's coming and hoard it, take more than they need because they're frightened. This is a natural reaction, but that means that a large section of humanity either never gets it or gets it far too late. We've seen this with HIV. We saw this during the H1N1 pandemic. We've seen it over and over and over again. Even if you were not idealistic, if you didn't care about your fellow man, that's also just silly. It's bad science, it's bad population management, it's bad infection control for one group to be successfully using an intervention and leaving the virus to circulate because the thing just comes back to bite you. We're already seeing that with variants.
So COVAX is vital, not just in vaccine access for lower income nations, but really every nation if we think about it through what it means for public health.
The idea is that we all need to get vaccinated at the same time. We all need to give the vaccination to the highest risk groups, the people most likely to catch the virus, the most likely to get sick with the virus, so that once you've eliminated the likelihood of people catching and getting severe illness, you've already reduced the pressure on your health system. You've already reduced the opportunity for the virus to circulate a lot and then create variants. So you've done a lot of the job very quickly if you do it in every country in the world. if you do it wherever the virus is circulating. But if you only do that in a few countries, you've not solved your problem. And in fact, you're creating bigger problems for yourself because the virus will change and it will come back. So it may look good in the short term. In the long term, you've actually created bigger problems.
The stated goal for COVAX is to deliver 2.3 billion doses and to make them available by the end of 2021. The latest numbers fall short of that. COVAX's site says 193 million doses have been delivered. So what are the biggest challenges that COVAX faces in meeting these goals?
The biggest challenge is access to doses. So when it was set up, some of it was a bit of a bet on who was going to be able to produce the vaccine. So again, it was set up in April 2020 when there were research groups who may or may not produce a vaccine. And the work was to go to each of those groups and say, we will support you. And if you've got a vaccine that works, come to us, deliver it through us. Now, some research groups did agree, others weren't interested. The groups that were interested, one of them was AstraZeneca, and we did have access to a lot of AstraZeneca doses, but the main manufacturing hub that we were relying on for AstraZeneca was in India, and this is the Serum Institute of India. We're also relying on the manufacturers in Korea. AstraZeneca is quite interesting because they're manufactured in whole different sites around the world. Now, unfortunately, the Serum Institute of India was going to be providing the bulk of the planned doses for this year. And then India had its huge outbreak, and there was a great deal of pressure to use those doses locally. And there was also difficulties, I think, with the actual production as a result of this huge outbreak they had. So that meant that doses that were agreed to and were planned were not coming. And that has really slowed things down. The other thing that was problematic is the manufacturers we could go to had already committed to countries that had paid in advance and had booked enormous numbers of doses, way more than the size of their population. So very, very early on, I think you would have heard us screaming the end of last year about vaccine nationalism and saying to countries, yes, we understand you feel a responsibility to your populations first, but it doesn't make that much sense. It seems sensible in the short term, but in the long term, your populations will need to have other populations vaccinated in order to protect your populations. And so very early on, we were finding back in December, January, that we did not have access to doses that we would like to have had access to. And right now, we are still very much pressuring every country that has got access to large numbers of doses to please share those doses via COVAX.
We'll be right back. So materially, what does sharing mean? A lot has been made about the responsibility of high-income nations, especially when vaccination rates are very high in many of these nations versus low-income nations. The access is almost non-existent for some people. What does sharing actually look like? Is it the vaccine supply? I'm hearing that. Is it their place in line for those vaccine queues? Is it technology? To you, what does that look like?
All of the above. It really depends what they can do. And some countries have just said, yes, we've got excess doses here, we'll send them. You can use them. And that's happened with France, that's happened with New Zealand. In New Zealand, quite a number of Pacific nation countries, the vaccines were able to be sent to them. And with France, we've been able to send them to some African countries. So that has been possible. The other things are indeed saying, we've got a deal with company X for 200 million doses, you can have them. That was very helpful as well. But we also have been asking countries, when they've got an arrangement, to make it clear to the manufacturers to sort of cut through all the steps and speed up the means of getting those doses via COVAX. Sometimes there are fairly complicated arrangements that have been gone through. So that's another element of it, make it possible as quickly as possible for as many doses as possible to be shared. And finally, things like it's not so much dose sharing, but working with companies to do some technology transfer. And again, it's a company itself, but countries can have a lot of influence on manufacturers within their country in terms of assisting with technology transfer to other parts of the world. That's not quite the shortest term solution, but it's a medium term solution. If you've transferred some of the technologies, basically the how to do it, to manufacturers that have enough of the components to be able to manufacture the vaccine in places much closer to where they're needed, then we will speed up the access very much.
You alluded to this earlier in the conversation. When we're talking about logistics, this is a very complicated program that we're talking about in terms of getting vaccines in certain places. But in a certain sense, it's also very simple because it's about caring about your fellow man, as you mentioned. And there are nations in the world, that have millions in surplus of vaccines, more than enough to cover their population. Is there a moral duty to make sure that these extra doses are donated, to making sure that if there's enough, supply is not the issue for some people, they should be passing that on?
Well, there's certainly a moral imperative. Really, are there many humans who are fine about seeing millions of their fellow man die? And we are seeing, I think, 10,000 deaths per week still. In the Americas, we're seeing 3,000 or 4,000 deaths per week. So can you really stand by and watch your fellow man die is, of course, number one. But also, even if you really didn't have a moral cell in your body, it's self-interested. Because we are seeing where we've got these huge outbreaks, when you've got people so sick, that they are producing an enormous amount of virus while they're so sick. And if you have an outbreak running out of control, the virus has so much opportunity to develop greater fitness. And as I said, the variants at the moment we are managing, we've just got the upper hand because the vaccines do protect against severe disease and death. So again, as I said, where you are getting vaccinated, we have seen deaths drop drastically. But the variants are developing means to escape vaccines, developing greater sort of immune evasion fitness. So ultimately, we will be in a situation where we're constantly playing catch up. Now, we've got great vaccines. We've made a fantastic effort. There are 18 different COVID vaccines being used around the world. That's extraordinary. Within basically 1 year of even thinking about this problem, we've got this going on. So let's, for the first time in human history, be smart and decent about it and distribute them properly.
As you were mentioning, even from a purely self-interested view, epidemiologically, when we're talking about how this virus circulates, this means the pandemic goes on longer, right?
Yeah, exactly. So insisting on sharing your vaccines is the most unselfish thing you could do. It's kind of counterintuitive. In other words, you can help yourself while being really decent.
I know that COVAX, again, in a certain part, especially in the early stages of vaccination, essentially we're competing against nations in trying to get in line with pharmaceutical companies and getting vaccines. So money is a big part of it in terms of the funding. I understand that back in June, there was a recommitment of $2.4 billion. That's from governments, that's from some private companies to fund COVAX. Is there a belief that as that funding continues, that we will see a shrinking in the gap of vaccine access between nations?
I'm not sure that the money itself will produce a shrinking of the gap, but the money is critical for being able to deliver the vaccine. So remember, there are enormous amounts of logistics involved. And also, once it gets into country, it must be delivered in very difficult and remote places. So there's an enormous amount of support, a large number of people who need to do this work and who need to be paid. And I'm talking about healthcare workers in the middle of nowhere. I'm not talking about people like me sitting in Geneva. You don't have to pay me, you're fine. So it's not just about purchasing the vaccines. In fact, under the COVAX system, if a country is able to purchase its own vaccines, they do. If they're not, they're what are called advanced market commitment countries. They may get the vaccine at a different price or no price at all, but the money doesn't directly pay for the vaccines as such. It's quite a complex financing arrangement, but the money needed is really to make the system work, to make sure that we can deliver the vaccines, because a vaccine's no good to you if it's sitting on the tarmac. You need it in everybody's arm.
Right. And I know that many people listening, of course, when we're talking about these huge sums and we're talking about geopolitics, this can be inaccessible. This can be very hard for people to think, okay, what can I do about this? And I also saw that the WHO does have a program for people who want to purchase individual vaccines, right? For people in need of this. Can you explain what that program does?
Yes, it's a really nice idea. It's called Get One, Give One. So essentially, if you've gotten vaccinated, think about donating so that somebody else somewhere else in the world can. And it goes through the WHO Foundation and goes into the COVAX work. So it doesn't mean that you actually purchase a vial of vaccine. It means you purchase the means of not just getting the vaccine, but getting the vaccine out across the world to somebody in the remotest corners of the world. So you really are making a difference. The other thing people can do is advocate, really put pressure on your politicians, put pressure on your decision makers, make it clear that you appreciate that they are looking after you, but to look after you, they need to look after the rest of the world as well.
Dr. Harris, thank you so much for making the time to explain this.
It's been a pleasure. Your questions are excellent.
And that is Dr. Margaret Harris, infectious diseases outbreak expert and spokesperson for the WHO. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachnick, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis, and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.